Hi, I'm Dr. David Naylor, and welcome to the Ask Dr. Naylor Brain-Based Therapy website. Maybe you're online right now because you are frustrated. Frustrated because you or a loved one is suffering from a chronic condition and you're worried. And worried because you have been told you're going to have to live with this problem for the rest of your life. Or you're sick and tired of being on the medical merry-go-round and you're taking a pill or drug for this symptom or that symptom or this condition, and you're tired of living your life frustrated. You're tired of being sick and tired. Or maybe you've just been diagnosed with a new condition. You're concerned that you're not familiar with the new term. You don't know what it is, and you're online trying to find out who is the best healthcare professional for a specific condition you have. I do want you to know that this website's made specifically for you. Because if you're suffering from any of the conditions that you see below this video, I want you to know that we've had phenomenal success with patients who suffer from these conditions, chronic type of conditions, and you're probably not going to have to suffer any longer. Now in our clinic we use what is known as brain-based therapy. I'm going to talk about that here in just a moment. Now as a primary healthcare provider, one of the things that frustrates me the most is when a patient comes into the clinic and says, Dr. Naylor, I wish I'd met you 10 years ago, before my husband had his failed back surgery. Or I wish I'd met you 14 years ago, before my child was diagnosed with health problems, and we wasted 14 years of his life because we were taking medications and going to doctors that didn't really understand the condition. They were treating the disease or the condition instead of the child. And now we bring him to your clinic, and 2 months later we have a healthy, functioning individual. Or you have a parent who comes in and says, before we came into this clinic, we thought that there was no hope for my child. He has had ADHD. He wouldn't pay attention. Coming to your clinic in 2 to 3 months, he's doing 2 letter grades better in school. Patients that come into the clinic with fibromyalgia, just a 50-year-old woman who can't even function as a mother or a grandmother, can't even function as a human being, can't carry on sentence structures, starts talking in sentences and then she loses complete train of thought before she finishes her sentences. Patients who come in with peripheral neuropathy. That means numbness and tingling and burning in their hands and feet. Patient can't even walk 200 feet before they have to get in a wheelchair. Now I want to assure you that we've had phenomenal success with patients who suffer with these types of conditions. And the reason we have this type of success is because of the brain-based therapy protocol that we use. Now I'm a chiropractor and an acupuncturist. Now most people are familiar with medicine. You have general practitioners and then you have specialists. Now chiropractic today is exactly the same way. You have general practitioners in chiropractic that work on patients with neck pain and back pain. And then you have specialized doctors of chiropractic like chiropractic neurologists that specialize in functional neurology and neurological problems. Now in this clinic, we're going to be focusing on working on 5 different areas to maximize your health potential. The number 1 is we treat the person, not the label. My philosophy is labels are for cans, not for people. Number 2 is the big picture is that your brain controls every function in your body. In order for your brain to survive and to function at its maximum level, we have to have fuel and activation. Fuel comes from the food that you eat, and if it's broken down into glucose, we take in oxygen, and the oxygen is attracted to the glucose and turns into energy and allows the body to start the healing process. Number 3 and 4, we also have to apply therapies and lifestyle changes. Now my job is to apply the proper therapy for activation, and the only way that I can apply the proper therapy is to do a comprehensive neurological evaluation. I also have to teach you the proper lifestyle changes in order to allow healing to occur as fast as possible. Another point that really frustrates me is when a patient comes into the clinic and they've been on blood pressure medication for years, or they've been on high cholesterol medication for years. And I ask them, what's the doctor previously taught you in lifestyle changes so you can get off these medications? They're like, well, he hasn't taught me anything, just said that I'd have to take this for the rest of my life. Now in our clinic we're going to give you that option of teaching you how to make the lifestyle change and then go back to your primary health care provider and your cholesterol is back to normal to see if he will take you off that medication. Well, if we can get your high blood pressure back normal through lifestyle changes, by all means you'll need to talk to your primary health care provider and get off that medication. Number 5, we have to do metabolic testing. We have to do blood work to find out what areas you're strong in and what areas you're weak in. Like for example, when it comes to minerals, there's 90 known minerals that you need in your body to sustain health. If you're deficient in one of those minerals, there are 10 known diseases that can occur with being deficient in just one mineral. So there you have it. I've gone over what we want to be looking at from a brain-based therapy standpoint. I've gone over how we help patients with these chronic conditions. and I want you to know that this website's made for you. But if we accept you for care here, you're probably not going to have to suffer with these chronic conditions anymore. Now, if you have any questions, you can hit the contact button above me. My phone number is on there, or you can email me. I'm Dr. David Naylor, and thank you so much for listening.